Hi, I'm Laura Flanders of The Laura Flanders Show, where I interview the best thinkers and doers of our time. On TV, the show premieres Sundays at 11:30 Eastern on PBS World and at the Laura Flanders Show YouTube channel. You can join my guests and me every week there in the live viewing party, and then catch us all week on public television stations. Prefer to listen? Find us on a radio station near you or subscribe to the free podcast. You'll find listings and ways to subscribe at lauraflanders.org. That's also where you'll receive my regular commentaries. I call them the F word. Here's this week's. American police are armed to the teeth with military-grade weapons courtesy of the Pentagon, and the results are in. The more combat gear, the more combat. So how about we armed our cities with military-grade healthcare instead? The U.S. Department of Veterans Affairs is part of the most generously funded institution in the government. And guess what? All that investment pays off. It may not be perfect, but in contrast to the rest of our health sector, instead of being fragmented, fractious, profit-driven, and poorly prepared, the VA is national, integrated, non-profit, and relatively effective. It's national. The VA operates thousands of healthcare facilities, including 170 medical centers and 1,000 outpatient sites besides. It's effective. Its response to COVID's shown what's possible when your healthcare system's funded and it's actually a system. While other vaccination programs rolled out in fits and starts, it pulled its response plan together last summer and began vaccinating veterans before Christmas. Knowing the history of hesitancy, the VA held listening sessions with minority veterans that gave them a jump on building trust. Now they report only 2% refusals and an inoculation rate above the norm in every race group. According to the VA website, in just 3 months, the VA's distributed over 3 million doses to over 2 million vets, plus their partners, their caregivers, VA employees, and loads of other federal workers. As Linda Ward-Smith, a VA nurse from Las Vegas, told my program this week, that's one good thing that the VA does well. We communicate. Finally, it's nonprofit. While the private sector and even many non-profit hospitals and healthcare systems have been firing or furloughing staff because the high-dollar procedures they make their money off weren't happening during the pandemic, the VA has been accepting non-veteran patients and sending staff to 49 states and territories. They've vaccinated people all over the country, including rural vets in Montana and homeless vets in Dallas. As Dana Brown, executive director of the Next System Project at the Democracy Collaborative, told the show, there's just a real difference here in what the logic is. The defining logic of these systems. One is care, the other's profit. So none of this means I've been won over to the war machine, but I do wonder, if the COVID pandemic is often compared to a war, doesn't that make all those of us who've survived veterans of it? If veterans can get lifelong integrated care with no copays, why can't we? Veterans care for all? I'd far rather health care spilled out of that bloated Pentagon pipeline than pepper spray and bullets. You can read about the results of the Pentagon Police Program at Jacobin.org and watch my conversation with 2 nurses and Dana Brown on The Laura Flanders Show, now on public television across the country and available to radio stations and as a podcast. Find out more at lauraflanders.org. And thanks.